I'm Sky.
I'm Angela.
Manny.
I'm Nick.
Today I will be talking to you about autism spectrum disorder. Autism spectrum disorder is a developmental disorder that can cause social, communication, and behavioral challenges. About 1 in 68 children are identified to have autism spectrum disorder. It is 5 times more common in boys than it is among girls. So throughout this speech today, we will be talking about the causes, signs, symptoms, and treatments of ASD. So what are some signs of autism spectrum disorder? A child who might have autism spectrum disorder has a daily routine that they follow. If you were to change one thing in their routine, then it would cause them to have meltdowns or tantrums. Parents are usually the first to notice ASD in their child. And some signs that a baby might have ASD are that they focus on certain objects, rarely make eye contact, fail to play back and forth with each other, and they rarely point or wave. Some signs that a child might be developing ASD are that they lose interest in others, become silent and withdrawn, prefer not to be held or cuddled, and repeat words and phrases, which are known as echolalia. Some symptoms are social skills, communication, and unusual behaviors. When it comes to social skills, it is the #1 most common symptom of ASD. They have a hard time developing friendships and sharing with others, which causes them also to have a hard time developing friendships. Communication is another one, and it's about 40% of children who have autism spectrum disorder don't talk at all, and about 25 to 30% of children with ASD learn some words, but then end up losing them later on. When it comes to unusual behaviors, they line up their toys, they're very organized, and they thrive on routine. Now, what are the causes of ASD? There isn't one specific cause, but there are 2 things that doctors might have considered, which are genetic and environmental factors. When it comes to genetic factors, 9 out of 10 show that identical twins with the same genetic code, that if one twin has autism spectrum disorder, that the other twin might also have autism spectrum disorder. Siblings who have another sibling with autism spectrum disorder have a higher chance of also developing ASD. When it comes to the environmental factors, a mother who was older when she had the child puts their child at risk of autism spectrum disorder. So now, how are we able to treat ASD? There is no proven way to treat ASD, but there are a few ways that reduce symptoms, which include therapy, dietary approaches, and medicines. Some therapies include occupational, which teaches them to dress, eat, and bathe themselves so that they are able to live independently. Another one is sensory therapy, which helps them with sensory information. Also, when it comes to kids with autism, they're very attracted to water because of their sensory information, which sometimes causes them to jump in the pool, so you really have to be aware of where your child is if they have ASD. Another one is speech therapy, which helps them learn to communicate with others. There's one thing that's called the Picture Exchange Communication System, also known as the PEC system, where they are able to take a picture that has like a cup on it, and they'll show you, I want the cup, or a picture of like a bathroom showing I need to go to the bathroom, and that's the way for them to be able to communicate. They also use this so that they can make sentences to be able to communicate if they can't talk. When it comes to dietary approach, it could help one child but not all. Just by changing the diet of a child with autism spectrum disorder, it can help the way they act or feel during the day. The medicine doesn't cure ASD, but it does help with their ability to focus, their depressions, and seizures. For example, my brother Dylan, he's on medicine which for seizures, headaches, and sleeping, and you can notice a change while he takes them. If he doesn't take them, then sometimes he becomes cranky or he can throw tantrums, but when he does take them, he's very calm. Another thing is that wandering is a very big issue with kids with autism. So if your child does run off, or if you are happen to run into someone with autism, you need to stay with them and make sure that they don't wander off even more, and just call somebody to help just in case, because if you leave them, they'll just wander off again and you won't be able to find them. Now that we have learned about the signs, symptoms, and causes and treatments of ASD, parents who believe that their child might have ASD can have their child evaluated and get help. Although there is no cure for the child, they could get help medically or therapeutically and can learn to live an independent lifestyle.